Well, first and foremost is where we are today here in Brecon Ward. We underwent an expansion in the last 18 months, which gives us additional capacity, scope and range. It's been a fantastic piece of work for us, and here we have Anna, our ward manager, to explain a little bit further about what happened.
So Brecon has gone from a 10-bedded bay. We have extended over the last 18 months, adding an extra 12 beds onto our unit. So we now have 2 extra bays and 2 side rooms. This has been made possible by funding from the Plymouth District Leukemia Fund, which has in all made it a much more pleasant experience for our patients and patient journeys, meaning that they're all able to be seen under our unit rather than being outlined throughout the hospital, which overall is a great experience.
So the thing we're second most proud of is our accreditation as a haematological and immunology service. So it's called QPIDS for short, so our quality and primary immunodeficiency services. It's our kind of a standard accreditation, but actually it's really important to prove to patients that we're safe, effective, and really caring, and we can deliver a really quality service. So we're very proud of that. And our third and final thing we're most proud of, obviously, is the contribution towards the COVID vaccine. So our team contributed a massive amount of research and input into providing what we now take for granted is our vaccine for COVID-19. It's been proven instrumental for the department. It's generated a huge amount of positivity and resource as well. So we're particularly proud of that and our contribution to the national drive. So what we're working on right now is we're working on our workforce models. We need to make sure we're fit for the future, so not so reliant on medical cover, really important, but also just making sure that our nurse-led clinics are bolstered, improved, and creating more capacity for our patients. The numbers are going up, we know that, and that leads us on to our second point really, is recovering our services that we had to sort of pause a little bit during the pandemic. It has created a little bit of a backlog, but it's nothing we can't overcome. It's just making sure that we recover our services in a safe manner. And then final piece of work really is some of our improvement work that we wanted to do, and we're actively doing some what we call huddles in the ward now, just looking at small incremental changes, incremental gains that overall make a fantastic difference for this ward and for the rest of the Heme and Im team.
Yep, so I'm Beck Parkin and I've been on Brecon Ward for about a month now.
And what's it like?
It's the treatment is very hard going, but the staff have been amazing and they will drag you through your treatment, kicking and screaming if they have to, carrying you through it. And they've just, without exception, been brilliant. So my personal experience at Brecon Ward has been really good. Where I was nervous when I came because I'd never been treated here before. So I didn't know a single member of staff before I came. So I was quite like, oh my goodness, there's a lot of names to learn. And I know I'm going to be feeling poorly and will I ever get to know anybody? But there's just little touches like putting the names on the board and so you know who's looking after you. You don't have to keep asking. And it's just, there's so many special people on the ward. I mean, I think everybody was special, but there's just so many different people that come in from different angles. There's one lady that calls everybody Baba, and I said to her on the first night, that's my husband's nickname for me, and ever since then that's it. That's all we call each other, and but it's all those little touches and all those little things. It's the housekeepers are so friendly, but they also know when you're having a bad day. They back off, they come in and they sneak round the bed and you don't even know they've been and gone. So yeah, just really, really nice bunch of staff.